In this exercise for ankle dorsiflexion, our professional key is having our client perform a weight-bearing lunge. For the active test, our client is trying to shift his body weight to get his knee as far past his toes as possible on his own while keeping his front heel on the ground. Using a stick, Key will be measuring how far the client can get his knee past his toes. The distance measurements for our client's active test was 17 centimeters for his right ankle and 13 centimeters for his left. This means that his range of motion was greater than 10 for both sides, all while keeping his knee in line with his hip and foot. For the passive test, our client will be doing the same lunge, except for this time, our professional Key will be assisting by applying pressure from behind in order to push our client as far forward as possible. Both distance levels for our client's passive test were within the level 2 and 3 range of motion for both his left and right sides, and he managed to keep his knee in proper alignment with his hip and foot.
In the shoulder flexion test, we measure the range of motion through fist of the test arm crossing the C7. Before the test, we observe the distance between our client's ears and shoulders. During the passive test, Key helped our client to reach as far as he can, passing the C7 without any discomfort. Key had made sure that our client's back and shoulders were controlled throughout the test. Our client, on both sides, was able to reach past the C7. Without a doubt, our client was in level 3 for his passive shoulder flexion test. For our client's active test, our client will execute the task while his shoulders and back are controlled. And Key measured the distance between the C7 and fist of the test arm. His right arm measured at 9 centimeters, while his left arm measured at 8 centimeters.
For the hip flexion exercise, our professional Key is having our client lie down flat on his back with his hands to the side. For the active test, our client will be doing this unassisted. That means his results will be influenced by both his joint and muscles and his coordination and strength. For the left side, his lateral malleolus was within the level 3 range. However, the client did not keep his knee straight. If he kept his knee straight during the test, he would more likely to be within the level 2 range, having the outside of his ankle, his lateral malleolus, reach less than the midpoint of his leg on the ground. For the right side, his lateral malleolus was greater than the midpoint of the leg on the ground, and that is within a level 3 range. For both his left and right sides, his range of motion remains within the level 3 range, meaning that the distance his ankles were greater than the midpoint of his ground leg. Unlike during the active test, our client managed to keep his left leg straight with the assistance of Key. In terms of control during both tests, our client managed to maintain a natural lower back curvature in reference to his starting curvature.
In the Y balance test on our client's lower extremity, Key had given the basics instructions to our client to balance on one foot and slowly slide out the object, and we conducted 3 trials for each direction to get the better representation of our client's range of motion. The average of 3 trials were left anterior 83 centimeters, left posterolateral 89 centimeters, left posteromedial 88 centimeters. His right anterior measured at 85 centimeters, right posterolateral 92 centimeters, right posteromedial 88 centimeters.
Question 1. When our client did the ankle dorsiflexion, his active mobility was restrained on his left ankle with a measurement of 13 centimeters, or the second zone. However, the client's passive mobility was significantly improved because he reached the 4th zone. For the shoulder reach, his right shoulder could actively reach 8 centimeters below the C7, but when he did the passive reach, it became 10 centimeters below the C7. The active and passive hip flexion was very similar in both legs. He reached level 3 in passive and active. He was clearly in pain and discomfort during his hip flexion whenever he was forcing his leg. Question 2. During the Y balance test, we could see that our client was more comfortable on his right foot. The client's right ankle is very flexible compared to the other. This is even more evident in the Y balance test because his right posterolateral movement was 91 centimeters compared to his left foot, which was 82. We can see these results that his ankle's mobility in the right leg is far better than his left. Question 3. Yes, I would use the same 4 tests on client A for many reasons. Client A wants to be more active in his life. For us to be able to help him, we need a base of his capabilities. We would conduct these tests to see where he is at in his flexibility and stability, because we all know you need those components to be a good dancer. If we conclude that his hip flexion is not great, that would make it very difficult for him to move freely on the dance floor and have smooth moves, especially in salsa. Also, if client A is looking for a new stretching routine, this test will show where he needs the most stretching in his body to be able to move freely.